This is Maria Zanes, President and CEO of bioAffinity Technologies, Inc., trading on the NASDAQ under the ticker symbol BIAF. bioAffinity Technologies is an early stage company, but it has a commercial test for the early detection of lung cancer. Lung cancer is the leading cancer killer nationwide and, in fact, worldwide. One of the reasons that it is such a deadly cancer is because it's most often found in late stage. What we have is a test called CyPath Lung, and CyPath Lung is a non-invasive test to improve detection at very early stage. Our test, CyPath Lung, has been found in a clinical trial to have very high sensitivity, meaning very high ability to find cancer, but also very high specificity, meaning it also can determine that someone does not have cancer. And this is particularly important and particularly focused on people who are at high risk, so heavy smokers, and those who have small lung nodules. So ours is a test we believe can really make a huge difference in the diagnosis of our leading cancer killer. The estimates are that the lung cancer diagnostic market is about $2 billion in the US. I think that it is also important to remember that ours is a platform technology. And as a platform technology, what I mean is it's not only a technology that can help to diagnose lung cancer, but it also will be used and advanced as a test for helping to improve the diagnosis of COPD, chronic obstructive pulmonary disease. And that's also a $2 billion market. It's important to understand that CyPath Lung is commercial. It has been validated and it is offered by a CAP/CLIA, by a commercial laboratory in Texas called Precision Pathology Laboratory Services. As a laboratory developed test, it must be sold by the laboratory that has developed it. In doing so, we actually acquired that laboratory that gives us both the reach, the resources, and indeed the revenues in our own backyard. We want to make sure that what we have with our branding, with our outreach to physicians, with our market research is spot on. And I think that we've done that recently. And so what we are beginning now to do is to commercialize in Texas. And then after we complete that program, we'll look at a nationwide launch. What CyPath Lung allows, though, is because you collect your sputum at home, so you're given a small cup, small box, you have a patient coach who calls you, who helps you to collect if that's necessary. And we get very, very good samples this way. But you're at home, and that's where you collect your sample. Then the kit itself has a pre-addressed, prepaid FedEx envelope. You put the sample in, and it goes to the lab. The lab then processes that sample, and within 3 days, your physician has a report, which tells him or her whether or not there's malignancy, it looks like there's a malignancy present, or that it's a low risk. CyPath Lung is a test that looks at the lung microenvironment. In other words, it looks at how the lung is changing and has changed because cancer is present, a malignancy is present in the lung. It does this by looking at cell populations, at whole cell populations. And using an AI-driven automated analysis, we're able to very quickly, after a sample is processed, determine whether somebody is at very high risk and therefore should move forward with more invasive or aggressive procedures, or the individual is at very low risk and therefore he or she can go and wait to the next time they need to have screening. In addition to which, ours is a technology that has a large addressable market. We're looking at a $2 billion market for lung cancer diagnosis. And remember, ours is a platform technology. So our next test we look to develop in COPD equally has a $2 billion market. So with this large addressable market and meeting a very, very important need, health need, we think we have a winner. We also have a clear path to revenue growth.
We understand now the market, and we are building step by step to a national market and then to an international market for CyPath Lung. That's important. Furthermore, we are doing that with some exceptional people, both in our management and on our board of directors.
If you would like to learn more, please visit our website at bioaffinitytech.com.